because I'm going to poke you. So your eyes has to be on this one that I'm not going to. Remember, the first thing we're going to do, grab your needle. Keep this because you're going to need it. Twist it. I'm going to put this down. I'm going to grab my medication. Going to make sure this did not expire. The right medication. Grab my alcohol wipe. Grab your vial. Every single time, clean your vial. The provider says 0.5 ml. So safety out of the way. Open it up. And then we're going to go ahead. Prior to open it up, you guys should put 0.5 air in your syringe, right? We're going to inject it. Lift it up. The air goes in. And then you're going to push the medication. I always pass the amount I want. So I'm not seeing any bubbles or anything. And from here, I'm going to put my vial down. Go ahead and single hand scope. Leah is going to keep an eye that that needle is not touching anything. If that needle touches anything, that needs to get switched, right? Click. We're going to check. We're going to make sure there's nothing. My medication is ready here. I'm going to put my label on it, right? So we know the right patient or everything. Always ask your patient which side they want to go. Prior to that, always have your Band-Aid ready. So I always go ahead and keep my Band-Aid one side of them if I can open it. So I'm gonna go ahead and keep one side open on my glove. The other side is still here. So when I'm done, I can just go ahead and put it on my patient. All right, Miss Leah, which side would you like me to poke you? Okay, is it okay for me to touch you?
Yeah.
We already confirmed no allergies. She's not taking any medication. The provider approved it. We're all good to go. So I'm gonna go ahead and have you to go ahead and relax your arm for me. Put it down. Perfect. They should not be tensing it. If they're holding it tense, that's gonna hurt. The relaxed they are, the less pain they're gonna feel. I'm gonna go ahead and put 3 fingers because I want to find my acromion process. I'm just gonna have my patient to bring their arm, and you can relax on my hand. And just gonna lift your arm up and down. So I'm finding my acromion process. So I feel that gap right here. From my acromion process, 3 fingers down. So I'm gonna go inject her right here. Okay? I don't want to lose where am I gonna go. I'm gonna grab my alcohol wipe. Not touching that alcohol wipe. Very gently start from your circle. Work your way out. No blowing, no fanning. Okay? Always your sharp should be close to you, because as soon as that needle comes out, where does it go? Sharps. And sharp always should be at the side that you go to. So technically, sorry Nicole, you have to go outside. I'm gonna bring my sharp over here because as soon as I poke, I wanna go ahead and put my sharp in this sharp container. Try to have your gauze always ready in case your patient is bleeding or anything really fast. You're just gonna go ahead and cover it. I'm gonna pinch it from the top. I'm gonna poke, and this is ready to put it on my patient. No tensing. I always tell my patient to go ahead and leave your arm dangling so you're not holding it, okay? Would you like me to count or just go?
Just go.
Just go. Okay, so safety out of the way. I'm gonna hold it in a 90 degree, right? Gonna pinch it really tight. The better you pinch, the less pain your patient is gonna feel. Ready? Take a deep breath in. And done. Easy. What comes next? Safety. Sharps. All right, and gauze right on.
And now you get to do it on the other side so we can see.
Yes.
Okay. Anytime you give a patient immunization, tell them to move this around. When you get an immunization and you hold your arm still, the worst pain comes when you move suddenly. My doctor that I used to work under, she's like, "You done? Go swimming. Now time to swim." Because you don't want that medication to be collected in one side. The more they move, the medication goes around and the less pain they feel. All right? And now how long I'm going to watch her? I'm going to watch her 15 to 30 minutes, then I'm going to document. Per provider order. Flu vaccine was given on patient
Left deltoid.
left deltoid. No allergies, no question, no concern. Patient was observed for 25 minutes. All right? Am I missing anything?
No.
Oh, but were you on a lollipop?